The aorta is a large flexible artery which leaves the top of your heart, wraps downwards in your chest towards your legs, and passes through your abdomen just in front of your spine. Below the level of the kidneys, its diameter is usually less than 2 centimeters. When it is larger than 3 centimeters, it is called an aneurysm. An aneurysm is a widening of an artery caused by the thinning and weakening of its walls. Inflammation of the aorta over a lifetime causes it to weaken and expand. Some people have weaker connective tissue, leading to weak aortic walls. High blood pressure can cause stress on the aorta wall. High cholesterol can damage and weaken the wall, causing aneurysm. But the biggest risk is in men who have been smokers. Cigarette smoke causes inflammation and weakness of the aortic wall. Amazingly, as few as 50 cigarettes ever smoked places a person at risk. Other risks include high blood pressure, high cholesterol, having coronary artery disease or peripheral artery disease, chronic obstructive pulmonary disease or COPD. Men between age 65 and 75 who have ever been smokers are recommended to be screened for AAA. Men with a parent or sibling who had an abdominal aortic aneurysm are also candidates for screening. Screening women is not currently recommended as their risk of rupture is lower. Ultrasound of the abdomen from the tip of the sternum to about the level of the umbilicus is performed. The entire length of the abdominal aorta is carefully viewed until it divides into the iliac arteries, which feed the legs. Measurements in excess of 3 centimeters is considered an aneurysm. Scanning takes place in about 5 minutes' time. Your results will be immediately reported to you, along with follow-up recommendations. Here is how often ultrasounds are needed. 5 years for less than 30 millimeters, 3 years for AAAs measuring 30 to 39 millimeters, yearly for AAAs measuring 40 to 49 millimeters, every 6 months for AAAs measuring 50 to 54 millimeters. Finally, 55 millimeters or greater, immediate consultation with a vascular surgeon. An aneurysm can be surgically repaired when its risk of rupture exceeds the risk of the surgery for the individual patient. There are 2 main ways to repair an aneurysm. Open repair is where the diseased part of the aorta is removed and replaced with a Dacron graft. Endovascular aneurysm repair, or EVAR, is where a catheter is inserted via the femoral artery in the groin, passed across the diseased section of the aorta, and a stent is placed to bridge the aneurysm. Other important things you can do to decrease your danger from AAA. Visit with your doctor to discuss quitting smoking, getting blood pressure well controlled, a statin medicine to optimize cholesterol, taking aspirin. Consider metformin to slow AAA growth. You may continue exercise and non-contact sports. This helps keep the AAA from growing. Lifestyle and medical therapy to prevent growth of aneurysms to rupture size is critical.